TomoTherapy is a radiation therapy machine that's used to treat cancer. It has been redesigned to take advantage of some of the advancements in computer technology so that we can actually see tumors better, target them more accurately, and deliver the treatment in a more precise fashion. What TomoTherapy has done is it has combined an imaging device with the treatment device. So we have a CT scanner, in effect, that images the patient immediately before each treatment. By imaging the patient, we can see exactly how they're set up and be sure that we are targeting exactly where the radiation needs to be delivered. When we're sure about our target, then we can deliver a higher dose to the tumor, and we can also avoid adjacent normal tissues that don't need to be treated, and this helps us keep the side effects of treatment lower. There are hundreds of centers across the country that offer radiation therapy services using TomoTherapy. But as far as in Utah, northern Utah, the only site that currently has TomoTherapy is here at Davis Hospital. I'm kind of excited that Davis Hospital teamed up with my company, Gamma West, to bring TomoTherapy to Utah. When I trained at the National Cancer Institute back in Washington, D.C., we were developing these intensity modulated radiation therapy techniques, these advanced techniques for delivery of radiation therapy. And the development of TomoTherapy was occurring at that same time. So when I joined this group and came to Utah, it was my strong desire to bring TomoTherapy to Utah. And we presented this vision to Davis Hospital, and they were able to share that vision. They made an extensive capital commitment to bring this new therapy to Davis County, and it's been well utilized by the residents of Davis County. And many people from other more distant parts of Utah have recognized the advantage of TomoTherapy and have even traveled great distances to take advantage of it. TomoTherapy gives me a tremendous advantage when I go to war against cancer. It allows me to treat cancers like I couldn't do in the past. In the past, I'd have to make several compromises because tumors are located amongst normal tissues, and we have to limit our radiation dose to respect the tolerance of those normal tissues. Now with TomoTherapy, how I can shape a high dose exactly around a tumor, I can limit the exposure to normal tissues. I can give myself a better chance of killing and controlling those tumors while still limiting the side effects of my treatment. So I'm very excited that I don't have to make the compromises that I used to have to make when I was using old-fashioned traditional techniques. The side effects of radiation therapy are based on the part of the body that's being treated. And so there's different normal tissues throughout our body that respond in a variety of ways when exposed to radiation therapy. And so by using TomoTherapy, if we have a sensitive structure near a tumor, we can shape the radiation fields to avoid those structures. For example, if we're near the spinal cord, need to deliver a high dose to the tumor, we can avoid causing damage to the nerve that could lead to a paralysis. Yet still give enough treatment that controls the tumor and prevents the tumor from causing that same paralysis. If we're treating in the head neck region, we can sometimes reduce the sore throat or dry mouth or some of these other issues that are a common occurrence in using standard traditional methods. Anyone who needs radiation therapy as part of their cancer treatment is a candidate for TomoTherapy. The cases that are the most difficult benefit the most from TomoTherapy. Because of the way the TomoTherapy system is designed, we are able to conform our radiation dose to fit any size or shape tumor. As the machine rotates around the patient and picks from a variety of different treatment beams, it can focus in on that tumor from a variety of different treatment angles. And the summation of all those treatment angles is what deposits the dose in the tumor. So we can conformally shape our radiation fields to match any size or shaped tumor. The advantage of this is we can avoid nearby critical structures if they're adjacent to tumors, and we can follow the response of these tumors as they respond to our daily treatments.